let's get started on some Med-Surg. So I want to show people a couple of things real quick. I'm just going to pull up some stuff that was, let me just pull up these documents real quick so I can show you exactly what to expect. So how many people, just in the chat, how many people would say that Med-Surg is probably one of the biggest topics that they learn throughout school, and or one of the biggest topics that you want to learn or have feared or things of that nature? It is, because it's medical and it's surgical. It's both, right? It's Med-Surg. It's very important. So I want to show you an outline of what Med-Surg typically entails in med school. Sorry, in nursing school. So what we're doing is we're going over the typical Med-Surg curriculum. So we've got introduction, obviously we got legal and ethics, and if I'm just going to scroll through this because I'm not going to read this out to you. Foundations, acid base, things like that, cardiovascular disease. Now I'm going to scroll back up. I want you to pay attention to this. Notice there's writing in red. Everyone notice that there's writing in red? Yeah, you know what that means? That's the section in our course that teaches it. Which means that people that are like, wait, do you teach Med-Surg? And I'm like, wait a minute, hold on one second. It's all there. I just do it system by system. Med-Surg is usually taught as a whole. So again, it's pretty evident that we actually teach every single part of Med-Surg, whether it be musculoskeletal, whether it be renal, whether it be neuro, whether it be endocrine, whatever it is, all these different things that pop up in Med-Surg that everyone is scared of. Med-Surg, Med-Surg, Med-Surg. No. You're learning it. I'm teaching it. It's on podcast. It's clearly what we've written in red is where it's at in our course. So even on demand, what we're going to do is we're going to upload this document once we finish adding in all the sections. When we talk about Med-Surg, one of the biggest topics is actually cardio. Then we go into obviously GI, mental health, but we're going to do a bow tie first. And again, these are topics that I've taught, right? These are topics that I've taught throughout the duration of the course, on demand, live, so on and so forth. So let's go ahead and do some practice questions, because the whole point of today doing Med-Surg is to talk about the different topics, especially the ones that are high yield. So the first one that we're going to do is actually renal. A 45-year-old male that presents to the emergency department with severe intermittent right flank pain radiating to the groin, nausea, and hematuria. All right. How many remember my little box of different points, right? So we've got our right upper quadrant, right lower quadrant, we've got our periumbilical, and we've got our flank pain. And if I said flank pain that radiates to the groin, what do we usually think? Because that's in a bow tie, they're going to give you clues, right? Because ultimately, the whole point of next gen is differential diagnoses. It's real life. They're giving you nursing notes. They're giving you a real life scenario. And what I've taught you, those of you that are in the course, those of you that have the on-demand, you know my diagram, and I say there's two different types, and I put the flank out here. Flank is actually in the lower back, but I kind of flipped it out so that way you can see it. So the flank pain is radiating to the groin. Now there's two different types of flank pain. PN with a line over it is pain. So flank pain with fever is going to be indicative of what differential diagnosis, or what diagnosis are we thinking? Kidney infection, or give me another term for it. Pyelonephritis, right? Pyelonephritis. So we have we have a couple of different differential diagnoses here. But this one, it says it's radiating to the groin. So they're giving you the clues in order to diagnose this, because in a bow tie, what's the middle part? The middle part of the bow tie is the diagnoses. Then on the left side of it is going to be what we're going to be doing. And then after that is what we're going to be monitoring. So in this situation, we've got flank pain radiating to the groin, nausea, and hematuria. What does this term mean? Hematuria. That means that we have what? Blood in the urine. Yeah, we have blood in the urine. So the patient reports a history of similar episodes. So do you think kidney stones happen to people regularly? Maybe they're predisposed, right? Once they have them once, maybe they have them over and over and over again. So good. So another clue here. Over the past year, he denies any fever, chills, or recent trauma. So we've ruled out trauma, but the fever and chills rules out what? It rules out infection. It rules out that pyelonephritis, right? So let's look at our nursing notes. Vital signs, 145/90. Why do you think the blood pressure is elevated right now? It's pain. Yeah, it's pain. Heart rate is 95, not tachy, but respiratory rate 20. And temperature is fine because, again, we said there's no fever or chills. Pain is 8 out of 10, and it's described as a sharp and cramping pain. UA is positive for blood, negative for nitrates and leukocytes. So the leukocytes would indicate what? Nitrates would indicate what? Infection. But the positive blood means maybe those stones are causing issues where it's actually causing that blood because of the fact that it's actually rubbing up against different parts of the kidney. Lab value WBCs are what white blood cells are normal, are BUN 20, cool, creatinine normal, calcium 10.2. Now we look at our bow tie. The first thing that we look at when we do a bow tie is what? What part of the bow tie are we looking at? The middle. We know that we're going to get 4 different options. We have 4 different options as a differential diagnosis. So we'll start with the bottom, urinary incontinence. Any indication that this could be urinary incontinence? No. Bladder cancer. Wait a minute. We've got some blood in the urine, but do we have any type of family history? No. What's one thing that is totally unrelated to the urinary tract or urinary system that actually can cause bladder cancer? Smoking. Smokers are at risk for bladder cancer. Yeah, it's one of those ones where the boards love asking that because it's not so in your face that, oh, this person has a history of bladder or family history of it. No, it's this person's actually a smoker. So, but again, no unintentional weight loss. We have no history of smoking, things of that nature. Renal stones. Well, we talked about the fact that this was pain radiating to the groin. And then UTI, any sense of urgency, any burning on urination, any nitrates or leukocytes? No, 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 no. So you see, not only am I doing this question and answering it, well, I know it's renal stones. I'm telling you why it's not urinary continence. I'm telling you why it's not bladder cancer. I'm telling you why it's not a UTI. This is how you have to study. Now, think about this. Could I have used the same question and made the differential diagnoses any one of those 4? Absolutely, I could have. Which means I need to know every one of these 4. This is where Med-Surg comes in. It's not just about knowing stones. It's about knowing everything in the renal tract, everything in the urinary system, and anything in the renal system. So you need to know all the signs and symptoms. You need to know the presentation. You need to know the causes. You need to know the differential between all of them. So we're sticking with renal stones. We already discussed that this would be renal stones. Now, What are we going to do about it? Right? What are we going to do? So we look to the left, and we've got 4 options as usual. And our 4 options entail educate the patient on straining urine to catch any past stones. Are we going to do that? Yes. Is that what we're going to do primarily? Let's see. Encourage increased fluid intake. Well, what do you guys think about that compared to educate them on straining? Fluid, fluid, fluid. Why? We want to be able to pass those stones. We can't pass those stones if we're not hydrated, right? So I like 3 so far. Prepare for CT scan of the abdomen and pelvis. Are we going to need to see the stones? We can probably see them on x-ray as well too. So maybe we can skip that one. And lastly, let's look at the first one, which is administer prescribed analgesics. This patient's in pain. This patient's in pain. 8 out of 10. 8 out of 10. So I want to take care of their pain. So yeah, I would 100% agree with you. I would go with analgesics and fluids. So again, can we do all 4 of these? Absolutely. Or is that what they're going to give you on the boards? Absolutely. But it's choosing the 2 that we want to do first. Priority. There you go. All right. Options. What are we going to monitor? Are we going to monitor the renal functions? Potentially. Yeah. That's definitely something I'm going to do. Urine output and presence of stones in urine. Whoa. Okay. So I do want to watch the renal function, but I definitely want to see their urine output, because if I'm hydrating them, I want to make sure that they're urinating, right? So I like the urine output more than the renal function. Renal function we're going to get, but right now, let's see how much they're actually urinating and see if they're passing those stones. Because ultimately, what am I doing? I'm hydrating them. I'm giving them fluids aggressively to get rid of those stones. To get rid of those stones. Signs of urinary obstruction or infection, of course, because ultimately, can those stones cause obstruction? And if we have obstruction, we'll have backup. And if that backup happens, what's going to happen? Stasis. And if that stasis happens, it's going to lead to what? Infection. So yeah, of course, we're going to monitor that. And then the first one is pain level and response to analgesics. Well, if I'm giving them analgesics, it almost makes sense to just monitor their pain level, because I may have to increase their pain medications. So we'll take pain meds, monitor their pain meds, and let's check their urine output. So does that make sense of renal? Like, again, part of Med-Surg, right? This is medical surgical. This is the renal portion, or a portion of the renal part of Med-Surg. So again, when I post that, those of you that have the on-demand, those of you that are in the course, when I post this Med-Surg outline and I put every section in there, you're going to see that you've already learned all this. You've already learned all this. So how are we feeling about this?